on culture, if you get more than 3 microbes, it's hard to isolate individual colonies, and so you're not going to get a sensitivity test for that. And a lot of times they'll mark those as contaminated because they can't get an individual isolate, where PCR, you can detect complex UTIs with 3, 4, 5 organisms and get the resistance for everything, so you can get targeted personalized therapy.
Yeah, early on. And I think that's what makes it so different too, is that we're able to detect those pathogens early on, 24 to 48 hours.
Exactly, and the simple fact is, if someone's on an antibiotic because they've had concurrent UTI that's lasted for weeks, you're not going to get a result for that for culture, because antibiotic use will affect the results. So, PCR, you can be taking an antibiotic for a month and it won't affect any of the results. That's the real benefit of PCR, and you get it real quick, whether it's aerobic or anaerobic, which can take 3 to 5 days via culture. You're going to get that in 2 days.
Yeah.
Very important in long-term care.
Yeah, so important. I mean, long-term care, they already have so many comorbid conditions going on.
For sure, because just the time to sepsis after an infection, or they get a UTI after a respiratory infection, can be 1 to 2 days. So if you're waiting 3 to 5 days for a culture, you could be already septic by then.